Hello students. So before we proceed further to aphorism number 255, let's take a very short quick look at the previous aphorisms. So let's revise it. There was a discussion on medicinal aggravation. So what is medicinal aggravation? Be clear in the concept. It means that remedy is wrong and appearance of new symptoms which correspond to the remedy administered. So in this case, be sure that the new symptoms have come in the totality and can be correlated with the remedy administered. In this case, stop the remedy and give antidote. We saw Sheen symptoms in aphorism 248. What are Sheen symptoms? They are again symptoms of medicine, but it is due to over repetition of dose of similimum, and the increase in the symptoms is only apparent. As soon as you will stop the stimulation of the remedy, the symptoms will disappear. So medicinal aggravation, remedy is wrong, appearance of new symptoms, stop the remedy. If the symptoms don't disappear, give antidote. And Sheen symptoms are due to over repetition of similimum. The symptoms of patient increase, and this is only apparent because as soon as you stop the remedy, they will disappear. Now let's move further. Aphorism number 255 describes the follow-up criteria for evaluation. So means what? You have administered the remedy. Now patient comes for the follow, and there is a system of also to how to take the follow up. It is not that you will inquire one symptom, then second symptom and third symptom without any system. There is a system. So which symptoms you will first consider for follow up evaluation? Which symptom the physician expects to get better first? So let's see. Even though if patients don't communicate or are unwilling to tell if they are ameliorated or aggravated. So sometimes patients don't communicate and they are unwilling to tell that they are ameliorated or they are having aggravation of symptoms. So physician goes through all the notes and asks the symptoms of disease one by one. Patients has no new unusual symptoms. So if the patient is not having any new and unusual symptoms, that is troublesome symptoms, no old symptoms are worse, then there is a improvement in the mind and disposition have already occurred, means medicine has made a positive effect or may soon effect it. So if there are no troublesome symptoms and no old symptoms have come and patient, it means that the improvement has started, and the first improvement will take place in mind, in the general symptoms. In the general symptom, that is mental generals and physical generals. So the first improvement, that is what I am telling you, the system of taking follow-up criteria. First symptoms to get improved are general symptoms. It is not that at first juncture all the particular symptoms will get improved. So first The symptoms to get improved are appetite, the general condition of the patient, that he feels fresh in his mood, he is feeling energetic. That is the most important favorable sign that the remedy is acting. So the follow-up criteria should be, first should be the general symptoms. So mood, the appetite, sleep, weakness, general sense of freshness, and then the particular symptoms will start. So the symptoms which will be improving first are general symptoms. If the remedy is appropriate, yet an improvement is delayed, it is due to errors on the part of patient which interferes with the action of the remedy, and they are obstacle to cure. So if the physician is sure of the remedy prescribed but the improvement is not expected according to the expectation, it means that there are some obstacles to cure. There are some things which patient is interfering with the action of the remedy, and they are the errors on the part of patient. Remember, the first improvement will be in general symptoms and then the particular symptoms. Don't expect that the first particular symptom, say cough, coryza, breathlessness, for example, will improve, but first the patient's general state starts improving. So aphorism 256, again follow up criteria, how you are going to do the evaluation of the case, how you are going to confirm that remedy you have administered is correct. If patient mentions the incidence of fresh symptoms, means new symptoms arise, and if patient is good natured then he won't tell. So sometimes patients don't tell that some new symptoms have arose because of their modesty or good nature. So example thesis, that is TB patient, lung abscess is common, he may not tell the change in the his symptoms. Physician should not believe in this case on patient's assurance, but he himself should assess the case when new symptoms arise. Consider the state is aggravated and don't just believe on patient. So always physician should be alert, he should be observant, he should be investigating the case for follow-up. So he should assess the patient, and that if new symptoms have come and if patient is not telling and telling just that he is better, then physician should not come into his follow up, but he should himself assess the new symptoms. Is it that the disease is aggravating? So this is a disease aggravation, and don't believe on patient. So here the point is, because of patient's modesty, he won't tell the new symptoms have appeared. If new symptoms have appeared, it means disease is progressing. New symptom is related to the disease. It means that the disease is getting aggravated. So 257 aphorism is about favorite remedy. So physician should not have any favorite remedy. True physician will avoid all the favorite remedies prescription. Now what is a favorite remedy? That by chance some remedies were useful, more often they are prescribed. Physician may not consider the remedies which were homeopathically suitable. So if the by chance that he has prescribed same remedy again and again, then physician may not consider the remedies which were more homeopathically suitable and they were more effective. So, physician may neglect such important remedies and may miss their prescription. So, physician may miss the prescription of more suitable homeopathic remedies. So, the disadvantage of that physician is having the favorite remedy is that he may miss the more suitable homeopathic remedy. Physician may neglect such important remedies and may miss their prescription. So, the physician should not be having any favorite remedy in his mind that every case I will prescribe silica, every case I will prescribe kalika because they are good, they have given the good results. It is not true. Every given case you have to assess the totality and prescribe. He should not be prejudiced that this remedy is better in this disease. There should not be any favorite remedy. Every case is different and the totality is also different, and just be unprejudiced to prescribe the remedy by selecting, by matching with the totality. Aphorism number 258 says that all remedies are good if similarity is matched. So, if you avoid some remedies because you have bad results with them, so it is as in 257, he says, Dr. Henneman is cautioning us that physicians should not hold any favorite remedy, and similarly, physician should not have any grudges that this remedy does not act. Then it is the fault of physician. So there should not be any favorite remedy, neither any unfavorite remedy. All remedies are useful when the similarity is matched with the totality. All remedies are useful and only when the similarity is matched with the totality. So every remedy has its good in it provided it is the matching is done with the patient's totality. No paltry prejudice should interfere with this choice. So 257 and 258. 257 aphorism is a favorite remedy many times asked in the papers and viva, and 258 says that there should not be any grudge against the remedy as you might have got bad result with them. Bad result comes only because of the selection is not done on the similarity. So physician should not have any grudge against the any remedy, neither he should have any favorite remedy in his mind. Okay, so that's all for today's discussion. Thank you.